97.9, 105.5, Kiss FM, DNCE, Nicki Minaj says Kissing Strangers. It's Liz and Big Papa.
And it's time for the Slocum Dickson Medical Moment, courtesy of Slocum Dickson Medical Group on Burstone Road, 798-1500, SDMG.com. And of course, like them on Facebook as well. Adrian, good morning. How are you?
Good morning. I'm great. How are you?
Fantastic. Things are growing and things are going so well at Slocum Dickson. Congratulations on everything. I hear through the grapevine that you're growing and looking for people.
Yes, we're hiring right now. So especially for LPNs. So if anybody out there listening is, graduating recently or even just looking to make a change, we have positions open for LPNs and then a whole bunch of other things too. Anything from we're looking for an administrative assistant to other kind of business office workers. So check out our website, sdmg.com. And it's really a great place to work, especially for nurses, because, a lot of times you get into a position where you're working weekends and you're working nights, and that doesn't happen at Slocum Dickson. We have the holidays off. You're usually not going to work weekends, regular hours, so you have some good family time. So it's really
awesome.
Good benefit there.
Yeah.
Absolutely, and especially in the medical field, like she says, a lot of people are pulling third shifts, and it's it's torture not only on your body but also on your family life as well. So that's very, very important.
Yeah.
Would you like to introduce who you brought with you today?
So today we brought Dr. D.IN, who's our newest oncologist at Slocum Dickson, and it's Skin Cancer Awareness Month, so we thought it'd be fitting for him to come and talk about it.
Dr. D.IN, good morning. How are you? It helps if I hit the button. I apologize.
There we go.
Let's try that again. Dr. D.IN, good morning.
Good morning.
Okay.
There we go.
So, skin cancer actually is something that hits home with both of us because on Tuesdays we have something called Confession Tuesday with life coach Rebecca Silence, and Rebecca actually just beat skin cancer. So that's like this absolutely hits home for a lot of people listening right now. Talk to us about like number one, what should we look for? Like, is it tabs? Is it, are there certain things we should definitely look for that people may not realize?
There are different kinds of skin cancer, and the most common type is basal cell cancer, and then you have squamous cell cancer. Basal cell, as the name sounds, it's really like it hits the base of the skin, and it's usually slow growing. But if you have a lesion that's kind of not going away, it's in a sun exposed area of your body, and it's starting to not feel right. Maybe it's itching. Maybe if you scratch it, it starts bleeding very easy. If you start seeing, there's a little crater or pit developing on top of it, then that's something that needs to be checked at. Similarly with the squamous cell, it forms kind of plaques or like rough patches on the body, and then there are the skin cancer that we really talk about in oncology a lot is melanoma, and in that you have a mnemonic to remember it by, to have something looked at is A, B, C, D, E, which means like if it's not round, if it's not symmetric, if the borders are not good, if the color is changing, if the diameter is more than the width of a pencil eraser, like 5 millimeters, or if it's just changing, which is the E in or evolving, then it's better to have it looked at.
Sure. When it comes to, I remember back when I was a kid.
Oh, here we go.
No, but seriously, it was, you could go out and, play in the sun, the whole thing, and sunscreen was optional. That's just not the case anymore. It literally is. If you're going to be out for more than an hour, you better lather up with something to protect yourself, right?
Yes, and I was looking up on some of the weather websites, the AccuWeather or some of the other websites that give actually UV indexes. So normally right now the UV index the ultraviolet light index is about 4, and the higher the UV index, the shorter the leeway or the time out in the sun that you can have without sunscreen. So in the past we didn't know about that, and we didn't have all these statistics or awareness programs. to actually let people know that this can happen.
Sure.
Right.
If there's something that you're looking at yourself, you're feeling something, and it's just not right, the best thing is to get checked out.
Yeah.
You know, that it's better safe than sorry, because rather than have it wait even a month, it could be the difference between life and death.
That's true.
And I hate to be
Yeah,
morbid about
but
it, but at the same time, you got to be safe about this stuff. It is the Slocum Dickson Medical Moment with Slocum Dickson Medical Group, located on Burstone Road, 798 1500 SDMG.com. Of course, like their Facebook page. They are really active on their Facebook page, especially with Skin Cancer Awareness Month, and there's different months putting spotlights on different like skin cancer and different causes and
Things to keep
different
you healthy.
Exactly, and they give you stuff to look for. So, Dr. Dean, Adrian, guys, thank you so much. We definitely appreciate it. And if you're LPNs, if you're looking for a new gig and you want to sleep in your bed at night, hit up Slocum Dickson. You're welcome in advance.